Surgeons are paid less for operating on female patients. That's according to a new Toronto-based study recently published in the Canadian Journal of Surgery. Right now, we're joined live by Dr. Michael Chaikoff, one of the authors of the study, an obstetrician and gynecologist at Sunnybrook Hospital. Thank you so much for joining us on CP24 Live at Noon. This was a bit of a head-scratcher when I read this story. Tell us a little bit about the key findings of this report and what really kind of, I guess, shocked you about it.
Absolutely. So we started by looking at surgeries that are performed on female patients, so patients with uteruses, ovaries, and other female reproductive organs. And we compared them against a list of similar surgeries that are performed either exclusively on male patients or primarily on male patients. Those are surgeries done by urologists. We then went across the country and looked at the publicly available billing schedules, so looking at how much a surgeon is paid for doing each of those procedures and compared to see, were you paid more for operating on a male patient versus a female patient? And what we found was yes. We found that on average across the country, you're paid about 28% less for operating on a female patient than for doing a similar surgery on a male patient.
So I guess from a surgical perspective, it seems obviously more profitable to operate on males. What do you do with these findings? I mean, obviously this is a bit of a head scratcher. It seems a little bit where we're using the term surgical sexism here. Is that the case? Is that what you feel?
Well, I did this study with a number of my colleagues, including Dr. Colleen McDermott at Mount Sinai Hospital. And in our initial discussions, we talked a lot about the pay gap for surgeons. So there have been many studies across Canada showing that surgeons who are women earn less than their counterparts who are men, despite similar levels of training, similar specialization, etc. So this adds a second layer to that. That's why we're calling it the double discrimination, where not only do you earn less by being a woman, but you also earn less by looking after women. And so to me, this is a jumping off point for advocacy for bringing a gender equity lens to the way that we pay physicians across Canada.
I mean, given the fact that there are different organs in a woman's body that a surgeon will have to kind of navigate through, it seems like and you please correct me if I'm wrong because I'm no surgeon, wouldn't it be a little bit more difficult and there's more, I guess, challenges navigating through the female body? Wouldn't that require a little bit more attention and time compared to operating on males?
It's a great question. I mean, and the comparisons we made in the study were not perfect comparisons, but we looked at a number of factors when we paired the procedures. So things like how long it takes to do a surgery, the level of complexity, as you said, what kind of training a surgeon might need to have to do a given procedure. But I think the example that illustrates this best is the example of gonadal torsion. So that's when either the ovary or the testicle becomes twisted. When this happens, it's an emergency. You can cut off blood supply to the organ and even lose the organ if surgery is not done within a timely fashion. Now, as we know, the ovaries are inside the body, so going and untwisting an ovary actually involves entering into the patient's abdomen. It's a more complex surgery, whereas the testicles are on the outside of the body, and untwisting that is more straightforward. That said, almost across the country, surgeons are paid less for untwisting an ovary. So that calls into question the value that the government is putting on female bodies versus male bodies in this respect.
What would you like to see done with this information, I guess, at the government level? What do you think lawmakers should be doing in light of this information?
Well, I think there's a couple of things. Number one, what I hope this data gives is a tool for advocacy so that the provincial medical associations can work with their local governments to examine their fee schedules through a gender equity lens. I know here in Ontario, Dr. Connie Nasello, who is our lead for obstetrics and gynecology at the OMA, has already made a number of amazing advocacy efforts. And I know that the Ontario government has already taken some steps to try and resolve some of these differences that exist. And I hope that that pattern continues across Canada. But from a larger perspective, this is really about healthcare for Canadian women. And what I hope I hope that the answers that we generated in this study generate a number of new questions. Questions like, do women in Canada wait longer for surgery than men? Are hospitals devoting more time, energy, resources, finances to conditions that are affecting male patients versus female patients? Because ultimately the goal here is to improve access to and quality of care for Canadian women.
A very important discussion. Thank you so much for joining us and sharing the findings of this report, Dr. Michael Chaikoff. Thank you.